is one of our local priorities to focus on treatments to be given, not just to be withheld and not just to focus on the DNA CPR. It's a record of agreed clinical recommendations. It'll be recognised across all boundaries, and some local other ICSs have already implemented ReSPECT. And what's also important is the training on ReSPECT will also be accepted across all organisations within our ICS. It's about a process that is based on a conversation. And sometimes it's more than once that they might have that conversation between themselves and a clinician or their clinicians that are involved in their care. For the patient, it focuses on recommendations for use in a future emergency, but it's not intended to be a comprehensive advanced anticipatory care plan, but it can open up the opportunity for those discussions. ReSPECT is a process to focus on the care and treatments that could benefit someone and what that person would want, and it's not about withholding of one treatment of CPR.
So across the Frimley Health and Care Integrated Care System, we're looking to adopt the ReSPECT process for adult residents. Essentially, anyone who's living with a complex health condition, living with frailty, or living with a life-limiting illness should be offered the opportunity to have a ReSPECT conversation and have their ReSPECT form completed. It's also for people who are at risk of a sudden deterioration in their health condition or of cardiac arrest. And of course, anyone who has strong feelings about their future care and treatment should also complete a ReSPECT form with their trained professional. We're hoping that across the system, all organisations will be adopting this process. And the reason for that is that even if you're not completing the form, you will need to have an awareness of the form, as this will document an individual's wishes about their future care and treatment. Each organisation will have a nominated ReSPECT champion, and it will be their responsibility to lead the rollout of the ReSPECT process locally. We will have some online training hosted on the Integrated Care System website, which will be available for you to undertake. However, it may be that organisations will want to deliver further bespoke training for their employees, depending on the level of training required. We're hopeful that the ReSPECT process will improve the quality of care for our residents living within the Frimley Health and Care System, and we'd be delighted if you would help us with this project.
ReSPECT is a nationally endorsed process that produces a series of personalised recommendations for a patient in the case of an emergency. It is a process that involves one or more conversations that are two-way between a patient and a healthcare professional, where they explore the patient's current health needs and clinical conditions and ensure that there is a clear documented summary of clinical recommendations for a patient in an emergency situation. This means that any future healthcare professionals who are responding to emergency situations with that patient have a clear summary of recommendations of treatment that the patient would like to have or may not like to have. Training across the Frimley ICS will be going live in May 2021, and we hope that all partner organisations within the Frimley ICS will signpost their staff to this training and support them with it and provide them with additional face-to-face training as is needed.
End-of-life care can be challenging to clinicians and to families as well as the patient, but this pandemic has added even more difficulties. Patients have passed without families and loved ones being able to say goodbye. Patients haven't had the chance to share their wishes or end with any sort of closure. ReSPECT allows some early dialogue in those that have an incurable and progressive illness, which includes frailty, and facilitate as dignified death as possible. The benefit of following the ReSPECT process allows open discussion about and reaching a shared understanding of the person's current state of health and how it may change in the foreseeable future, knowing full well in advance what the patient would have wanted, and gives a sense of fulfillment that we did the best for the patient under the circumstances.
So the benefits of ReSPECT from a community nursing point of view is that we are very aware of the patient's priority of care and the medical decisions that may have been made already for that care. The patient is also very involved in that decision making and helps us plan the care accordingly. So this may mean that we can focus our priorities on comfort measures if that's what the patient's wishes are and if that's what the medical decision is, or we can focus much more on interventionist care, again if that's a medical decision and the patient's priority. As it's a single document that travels through the acute units, other organisations like the hospice, into the community, it means we don't have to have repeated conversations with patients and their families, which at times can be very sensitive conversations and can cause great distress if you're asking the same questions again and again.
When it comes to ReSPECT and what it can do, I can talk from my own personal experience of being a Bangladeshi man and how it's affected my community. The process helps people think about future emergencies. So for myself, it's meant that we've been able to discuss and plan how we think about the care of our loved ones in advance. So when the time has come, it has saved us a lot of confusion and anxiety in preparing for an emergency. The process in itself is an inclusive process that puts the person that we love at the centre of everything that we do, which is where it should be, irrespective of what community you're from. The process brings a sense of order, organisation and calm at a time when things can seem very challenging.